Signs of heart attacks are very important, it can save us from death. The first hour of heart attack is known as the golden hour. There's a big chance of improvement if we will get help during the first hour. Many of the symptoms of heart attack can be brought on by digestive disturbances or other serious conditions. This is one instance where getting treatment promptly can mean the difference between life and death. Dizziness can be an early symptom of a heart attack. Cardiac chest pain is often vague, or dull, and may be described as a pressure or band-like sensation, squeezing heaviness, or other discomforts. Pain is not always a symptom of heart attack, it often starts with mild symptoms that may not be painful. Many victims experience tightness or squeezing sensation in the chest. Get medical help as soon as a person experiences any of the following 2 minutes or more: pressure, fullness, squeezing or pain in the center of the chest. Pain spreading to the shoulders, neck or arms. Severe pain, sudden weakness, dizziness, fainting, sweating, nausea, or shortness of breath. For those with angina, any changes in the frequency, duration or intensity of the attacks, or symptoms that don't respond to nitroglycerin. This condition frequently occurs from 4:00 a.m. to 10:00 a.m. due to higher adrenaline amounts released from the adrenal glands during the morning hours. Increased adrenaline in the bloodstream can contribute to the rupture of the plaque that causes the formation of the clot and the eventual heart problem. Those are some of the signs of heart attacks, so it is very important to be aware. The typical symptoms of this condition are similar to manifestations like those with angina, but it is more severe and lasts for a long period of time. Sweating, dizziness, and shortness of breath often accompany this condition. If the patient experiences chest pain that lasts for 15 minutes and cannot be relieved by rest, it is important to get immediate medical attention. Early signals of heart attack are uncomfortable pressure, fullness, squeezing, or pain in the chest. Usually it lasts for longer than 2 minutes, the pain that radiates to the shoulders, neck, jaw, arms, and back. Other symptoms of this condition are chest pressure, sweating, jaw pain, heartburn and/or indigestion, arm pain, upper back pain, general malaise, nausea, and lastly the shortness of breath. Angina pectoris or angina is a precursor to this condition. It usually occurs during physical exertion, stress or an emotional situation. In cold weather or after a big meal, it will result in very fast heartbeats. It requires more oxygenated blood flow to maintain the beating. But if the way to deliver the blood to the heart is narrowed, there are not enough nutrients to get to the heart muscle tissue. It will suffer from a deficiency of oxygen, and this is the time that the patient will feel the pain that we called angina pectoris. This pain is usually described as a heavy, strangulating, suffocating experience. It is far more intense than anything like indigestion, chest wall injuries, pleurisy or spasms of the esophagus. It is considered to be a scary episode, but with rest and being calm, it usually goes away in about 15 minutes or so. If it exists more than that, it can lead to heart attack, so it is very important to consult your health care provider to know the condition of your body, the heart as well. These signs of heart attacks are very useful to identify if we are experiencing any heart problems or if it is related to any other complications. If something went wrong with your heart, would you know it? Not all heart problems come with clear warning signs. There is not always an alarming chest clutch followed by a fall to the floor like you see in movies. Some heart symptoms don't even happen in your chest, and it's not always easy to tell what's going on. That's especially true if you are 60 or older, are overweight, or have diabetes, high cholesterol, or high blood pressure, says Vincent Buffalino, MD, an American Heart Association spokesman. The more risk factors you have, he says, the more you should be concerned about anything that might be heart-related. Especially watch out for these problems. 1. Chest discomfort. It's the most common sign of heart danger. If you have a blocked artery or are having a heart attack, you may feel pain, tightness, or pressure in your chest. The feeling usually lasts longer than a few minutes. It may happen when you're at rest or when you're doing something physical. Also, keep in mind you can have heart problems, even a heart attack, without chest pain. That's particularly common among women. 2. Nausea, indigestion, heartburn, or stomach pain. Some people have these symptoms during a heart attack. They may even vomit. Women are more likely to report this type of symptom than men are. Of course, you can have an upset stomach for many reasons that have nothing to do with your heart. It could just be something you ate, after all. But you need to be aware that it can also happen during a heart attack. So if you feel this way and you're at risk for heart problems, let a doctor find out what's going on, especially if you also have any of the other symptoms on this list. 3. Pain that spreads to the arm. Another classic heart attack symptom is pain that radiates down the left side of the body. It almost always starts from the chest and moves outward. But I have had some patients who have mainly arm pain that turned out to be heart attacks. 4. You feel dizzy or lightheaded. A lot of things can make you lose your balance or feel faint for a moment. Maybe you didn't have enough to eat or drink, or you stood up too fast. But if you suddenly feel unsteady and you also have chest discomfort or shortness of breath, call a doctor right away. It could mean your blood pressure has dropped because your heart isn't able to pump the way it should, Buffalino says. 5. Throat or jaw pain. By itself, throat or jaw pain probably isn't heart-related. More likely, it's caused by a muscular issue, a cold, or a sinus problem. But if you have pain or pressure in the center of your chest that spreads up into your throat or jaw, it could be a sign of a heart attack. Call 911 and seek medical attention to make sure everything is all right. 6. You get exhausted easily. If you suddenly feel fatigued or winded after doing something you had no problem doing in the past, like climbing the stairs or carrying groceries from the car, make an appointment with your doctor right away. These types of significant changes are more important to us than every little ache and pain you might be feeling, Buffalino says. Extreme exhaustion or unexplained weakness, sometimes for days at a time, can be a symptom of heart disease, especially for women. 7. Snoring. It's normal to snore a little while you snooze. But unusually loud snoring that sounds like a gasping or choking can be a sign of sleep apnea. That's when you stop breathing for brief moments several times at night while you are still sleeping. This puts extra stress on your heart. Your doctor can check whether you need a sleep study to see if you have this condition. If you do, you may need a CPAP machine to smooth out your breathing while you sleep. 8. Sweating. Breaking out in a cold sweat for no obvious reason could signal a heart attack. If this happens along with any of these other symptoms, call 911 to get to a hospital right away. Don't try to drive yourself. 9. A cough that won't quit. In most cases, this isn't a sign of heart trouble. But if you have heart disease or know you're at risk, pay special attention to the possibility. If you have a long-lasting cough that produces a white or pink mucus, it could be a sign of heart failure. This happens when the heart can't keep up with the body's demands, causing blood to leak back into the lungs. Ask your doctor to check on what's causing your cough. 10. Your legs, feet, and ankles are swollen. This could be a sign that your heart doesn't pump blood as effectively as it should. When the heart can't pump fast enough, blood backs up in the veins and causes bloating. Heart failure can also make it harder for the kidneys to remove extra water and sodium from the body, which can lead to bloating. 11. Irregular heart beat. It's normal for your heart to race when you are nervous or excited, or to skip or add a beat once in a while. But if you feel like your heart is beating out of time for more than just a few seconds, or if it happens often, tell your doctor. In most cases, it's caused by something that's easy to fix, like too much caffeine or not enough sleep, Buffalino says. But occasionally, it could signal a condition called atrial fibrillation that needs treatment. So ask your doctor to check it out. Thank you for watching. Please like, share and subscribe.